Peter Holmes, orthopedic surgeon, host of your program, Ask the Doctor. My guest this morning, Dr. Joseph Diaz. Dr. Diaz is an allergist, immunologist, and asthma specialist. If you have any questions for Dr. Diaz in the future, any of my other guests, two ways to reach me. Do it through our foundation. That's www.needfoundation.org or fax 696-9012. Well, as a lot of us have particular interests, I read through the stimulus plan and picked out some of the things that may affect your health. And I'm going to pull from some lines on here. This is from Bloomberg, one of those little boring things, but it's important for your health. It says the bill's health rules will affect every individual in the United States. Your medical treatments will be tracked electronically as required by a federal system. Having electronic medical records at your fingertips easily transferred to hospital is beneficial. It will help avoid duplicate tests and errors. But the bill goes further. One new bureaucracy called the National Coordinator of Health Information Technology will monitor treatments to make sure your doctor is doing what the federal government deems appropriate and cost effective. The goal is, quote, to reduce costs and to guide your doctor's decisions. Under new penalties, hospitals and doctors that are not meaningful users of the new system will face penalties. Meaningful user isn't quite defined yet in the bill, but will be. That will be left to the new Health and Human Secretary, yet to be named. It was supposed to be Daschle, who did put his things in. The stringent measures or meaningful use over time is yet to be defined. Now, folks, there's no free lunch. The government sprinkles out the stimulus package using our kids' future, and in here is something to do with our health care, electronic medical records and monitoring. More important is this federal council. This is a way, in my opinion, to monitor physicians electronically and instantly. So let's look at how this board is currently used in another country, since Daschle, who put these things in the plan, is the one that recommended it into the stimulus plan, and this is the one in the United Kingdom. In this thing, the Federal Council in the United Kingdom does the following. It takes the cost of a procedure and it divides it by the patient's age. If it hits a certain number, it may not be deemed, quote, beneficial. Beneficial in that term means cost effective. In other words, the older you are, the less likely you'll need the procedure, as deemed by this council. For example, at one point, nobody would go in the ICU over 90 in the United Kingdom. Now it's 59. If you break a hip, you will not go to the intensive care unit over 59. If you have diabetes and require dialysis, it's now the age 54 is the cutoff, because the council takes the age into the cost of the treatment, and it hits the number, you're out of luck. Macular degeneration, until 2006, they would not treat wet macular degeneration until you're blind in one eye. Obviously, this has been overturned after 2 years of protest. If you listen, Daschle, who put these things in the stimulus plan, says, healthcare reform will, quote, not be pain-free. Seniors should be more accepting of the conditions that come with age. Think you're getting something for nothing as you sprinkle my kid's future into a stimulus plan? What you're getting is rationing of your health care. These are my opinions. If you have any comments, two ways to reach me. Do it through the foundation at www.needfoundation.org or fax 696-9012 to ask the doctor.